Your baby has entered the world. He's breathing air for the first time, feeling your skin, seeing your face, and hearing your voice. It's all exciting and new. In this chapter, Understanding the Newborn, you'll learn about newborn characteristics and what medical procedures are available for your baby after birth.
Just my first memory, this Liz saying it's a girl, and just her there, and she was screaming and really flapping her arms around. I was actually pretty surprised by all that. I didn't think she would be so active. I was just trying to comprehend everything. Wow, this is our little daughter, you know, this is our child that we've been planning for 40 weeks, and this is her.
The hospital staff can start getting its work done while you hold your baby. Your doctor, midwife, or nurse may remove excess mucus from your baby's air passages as your baby lies on your stomach. The syringe reaches only into your baby's cheeks or nostrils, not down her throat. If there are greater concerns about your baby's respiration, a tube hooked up to a vacuum source might be used to more thoroughly clear your baby's airways. The umbilical cord will be cut after birth since your baby will no longer need it to receive oxygen. Your partner or labor support person might enjoy cutting the cord as a symbol of your baby's entry into the world. It will be clamped in 2 places and then cut with scissors between the clamps. Don't be surprised if the cord is thick and tough to cut, but baby and mom won't feel anything because there are no nerve endings in the cord.
The most exciting to me was being able to cut the umbilical cord, but I think that really brought me into that end portion of the process, getting to that finish line.
After birth, the nurses will determine your baby's APGAR score, and you probably won't even notice them doing it. It's simply an evaluation of how your newborn looks and sounds. Its purpose is to see how your baby is adjusting to life outside of the uterus. Based on muscle tone, reflexes, skin color, heart rate, and breathing, your newborn will be given a score. The numbers used to create the score are recorded when your baby is 1 minute old and again when he is 5 minutes old. The score usually does not predict anything about your baby later in life. When your baby's doctor comes to the hospital, your newborn will receive a more thorough physical exam. Soon after birth is the best time to start breastfeeding. Most newborns are alert and ready to feed or at least nuzzle at your breast right after birth. After that, they go into a deeper state of sleep and may be too tired to latch on. So unless your baby needs immediate medical attention, breastfeeding should be a priority. Maintaining skin-to-skin contact with your newborn can really help get breastfeeding off to the best start.
You're willing to do whatever it takes to bond with your baby. I needed a lot of support with the breastfeeding portion. Now it's like second nature.
When newborns feed for the first time, they get a special kind of milk called colostrum. This clear, yellowish, nutritious milk is exactly what babies need for their first meal. Colostrum is easily digested by your newborn's delicate system and is packed full of antibodies that protect him from sickness. You should tell the hospital staff that you're breastfeeding so your baby isn't given any formula, water, or pacifiers. If you're planning to bottle feed, you can give your baby his first bottle soon after birth. Your newborn will also be weighed and measured. Her size at birth is important in establishing a baseline for a healthy growth pattern later on. Footprints may be stamped for your baby's identification and for your own keepsake. Also for identification and security in the hospital, you, your partner, and your baby will wear identification bands printed with matching numbers. The bands should be tight enough so they don't slip off and should not be removed until you are at home with your baby. Certain procedures are available for your newborn and may be mandated by the laws in your state. Treating your baby's eyes with an antibiotic ointment is a routine procedure used to protect your newborn from eye infections and blindness caused by vaginal bacteria. The ointment is safe and does not cause burning or irritation. A vitamin K shot will be administered to help your baby's blood clot. In some areas, this can be replaced by giving oral doses of the vitamin later on. And many states mandate screening your newborn for genetic diseases, which involves pricking your baby's heel to obtain a blood sample. This blood is then tested to make sure your baby doesn't have any serious diseases that show no outward symptoms but need immediate treatment. The test is performed before you leave the hospital and will be repeated within a week. You have the right to refuse any treatment for your newborn, but you need to be aware of the pros and cons of doing so. You will also need to sign an official waiver if you are declining a procedure that is state mandated. Talk to your doctor if you have a concern about any of these procedures before your baby is born. As you are settling in on the mother-baby or postpartum unit, your newborn will either remain with you or will be taken to the nursery for a bath and observation. Your partner can accompany the baby to the nursery. After this, your baby will return to your room for another feeding and your loving care.
We put electrodes on the baby to track the brainwave response to the sound that she'll hear.
3 out of every 1,000 babies are born deaf or with severe hearing loss, but early intervention and rehabilitation can minimize effects on speech and language disorders. Many states have programs in place to test newborns' hearing, and it is done routinely in many hospitals. There are 2 common tests that measure your baby's response to sounds, and they are both safe and non-invasive. So talk to your doctor about it. If you have a baby boy, you will be faced with making a decision about circumcision, which is the removal of the foreskin that covers the head of the penis. The American Academy of Pediatrics states that existing scientific evidence demonstrates potential medical benefits of newborn male circumcision. However, these data are not sufficient to recommend routine neonatal circumcision. In fact, the number of circumcisions in the U.S. has dropped significantly in recent years. With this in mind, you must make a decision weighing the benefits and risks of the procedure along with your own personal and religious beliefs. If you're thinking about circumcision at your hospital or pediatrician's office, note that the American Academy of Pediatrics says that local anesthesia should be used during the procedure, so make sure it will be available. As you change your baby's diaper in the first few days, you'll notice the meconium, or first bowel movement, which is black and sticky. After this, your newborn's bowel movements will be green, and then change to yellow with a soft consistency if you're breastfeeding, and to brown with a more solid texture if you're formula feeding. Your newborn will fascinate you. While she may be the most precious thing you've ever seen, she might look a little different from what you expected. It's normal for her head to seem big compared to her tiny body, and it may be cone-shaped from being squeezed through the birth canal. Within a few hours or days, it should round out. Whether boy or girl, a newborn's genitals might look enlarged, which is normal. His skin may be covered with soft hair or a cream cheese-looking substance called vernix that kept him from pruning up inside the bag of waters. It works like lotion if you rub it in. A newborn's skin tone might still look purplish until oxygen starts to work its way through her body. All newborns appear kind of pale at first, but if their parents have darker skin, the color pigmentation spreads from the baby's back, causing a gradual darkening of the skin tone in the weeks after birth. It's also normal for African American, Hispanic, and Asian babies in particular to have bluish-green or gray birthmarks, usually on their backs or buttocks. Stork bites or flat pink birthmarks on the nose, eyelids, or neck are also common on babies of all backgrounds. Most types of birthmarks eventually fade away within a few years. Don't be surprised if your baby has dry skin or tiny pearly white bumps on the face called milia. In their second or third day of life, more than half of all newborns develop a harmless rash made up of red blotches with white lumps in the centers. Keep in mind that if your newborn has any of these, her skin should clear up on its own and no creams or ointments should be applied. Finally, a newborn needs to be kept warm, and your own skin is the best way to do this. When she's not held close to your skin, she's swaddled in blankets to help her stay warm. In the first few days, it's also recommended that your baby wear a hat, since a lot of heat is lost through her head. A newborn baby is not a blank page. Instead, he is born with abilities and reflexes. He wants to interact with you. He needs to have stimulation and comfort. This is why it is so important for you to spend as much time as possible with your newborn, learning about his needs and how to meet them. This is also why more and more hospitals are establishing rooming-in policies. Early contact is proven critical for a child's development and for establishing a strong bond between parents and their newborn. At the hospital and later at home, your newborn will communicate with you through behavior, so learning to read your baby's cues is essential. His automatic reflexes have a lot to do with how he expresses his needs. Rooting or turning toward your breast, sucking motions, or bringing his hands to his mouth let you know he is hungry, while grasping motions might tell you that he's ready to play. Newborns sleep for most of their day and move between 6 states of consciousness, including deep sleep, light sleep, drowsiness, wide awake alert, fussy, and crying. As a parent, you can learn to recognize your baby's behavior to know whether he's ready for sleeping, feeding, or play. For instance, try playing with him when he's most responsive, during the wide awake alert state. All 5 of your newborn's senses are active at birth. He can see best 8 to 14 inches away and likes to see faces in bold, contrasting colors like black, white, and red. He can hear and differentiate between a range of sounds and likes listening to human voices, especially his parents. A newborn will actually turn his head toward the sound of your voice. Touch is an important way for a newborn to explore her world. She can already feel temperature, texture, pressure, and pain, and loves to feel your skin.
I just love having her in my arms, and then half the time she stares up at me when I'm feeding her too, so we kind of get that eye connection going on.
Newborns also have highly developed senses of smell and taste and know their own mother's smell and taste from the amniotic fluid in utero. Keep in mind that with all of a newborn's active senses, she can get overstimulated. Things like turning away, sneezing, hiccuping, or fussing are all signs that there may be too much going on around her. Learning all you can about your newborn's world will help you understand and respond to your baby most effectively. The beginning of your baby's life is an exciting time, a time for you to make loving choices, a time to be together as a family. Learn all you can about your newborn's first weeks so you can enjoy these precious moments.